Taxpayer dollars will be used to bail out health insurance companies. That's right. The geniuses who wrote the law knew it wouldn't work, so they had to entice insurance companies to sign on. And what better way than to offer monetary insurance to the insurance companies? In fact, up to 3/4 of all losses sustained by insurance companies will be paid by you and me. Now, don't forget the $600 million and counting and growing on a website that still doesn't work. Congressman Darrell Issa has not forgotten.
The truth is that actual interviews and depositions taken of the highest-ranking people that helped develop this website, both public and private, shows there was no end-to-end testing. It did not meet the spirit of any definition of a secure website. In fact, the highest-ranking person, Teresa Fry, on September 20th, was unwilling to recommend this site to go active and said under oath that if it had been within her authority to stop it, she would have.
The website is a disaster, and several of the state exchanges aren't working right either. Tens of thousands of Americans who signed up for Obamacare may not be covered. Why? Glitches. Joining me now, private medicine advocate and Obamacare expert, Patricia Newman.
Hi.
Patricia, glitches? That's all these are. These poor people are caught in this nonsense, a kind of a no man's land that's been created by Obamacare, yet we have the administration trotting out there saying, hey, don't worry, all is well, we got it covered, we're going to fix it sooner or later.
It's amazing. These glitches continue to happen. Probably the scariest one of them is when the insurance company doesn't have record of the enrolled member, because the federal government has the record, supposedly has the money, yet the insurance company is not getting that information. So when that patient shows up at the doctor's office, there's no coverage. And this is difficult for somebody that has, let's say, a cancer or some really difficult illness. That gap in treatment or coverage of that treatment is dangerous for these patients.
Now, are these the ghost accounts we've been talking about?
These are actually the orphan accounts.
The orphan accounts. I'm sorry. I'm getting my Obamacare terms all mixed up. So these are the orphan accounts. These are people who went to the website, filled out all the information, and probably paid, I assume.
Right.
And yet there's no record that they did
The insurance company has no record of them. But there's more than that. I mean, there's the other way around, which is that ghost, issue, where the insurance company has record of the enrollment and the federal government does not. So again, they can't keep track of very simple features of an enrollment system. I mean, the federal government, through the exchange, has also issued the same ID number. This is an individual ID number, and multiple people share the same number. I mean, it's just pure ineptitude.
That's very scary to have the same numbers out there, because who knows what kind of cornucopia of identity theft that's going to open up. I mean, it's a mess. And Congressman Issa is right. This thing wasn't tested from beginning to end, from soup to nuts, like any private sector operation would. And really, it goes back to the company that developed this thing, the Canadian company, and these little, I guess they were hired because they were friends or indirectly friends of Michelle Obama. It certainly looks that way anyway.
Right. Well, CGI has done a horrific job. Everybody that I have talked to in the health IT industry, and I do have a lot of friends in that industry because we are IT nerds at our office. We like the technology. What we don't like is what comes with it, the loss of privacy that the patients may suffer. But CGI spent over $600 million that were given to them to do this project, failed completely. And then they got just canned last week.
Right.
I guess their contract doesn't expire till February. But on Friday, they received notice, and now Accenture is going to take over. So Accenture is this huge company, I think the second largest in the world consulting firm. And they were the ones that did California Covered. Well, their contract's only $45 million, so I guess it's not that much, although I'd like to have that in my pocket. But, you know, they're making it sound like, well, it's just $45 million. And that's for 1 year. These are the same people that did Covered California.
And Covered California has not been running as smoothly as the administration wants you to think, right?
No, they've had the same kind of issues where the exchange has no record of the insured members. Remember, we spoke about the issue. The website was not able to handle all the enrollments, so they were backlogged by tens of thousands of applications that they dropped on insurance brokers to enter manually because they just didn't have the capability. So now we've hired that company. That company made $359 million to take care of California Covered. They got the contract in 2012. They're going to run it or maintain it for 3.5 years. And guess who was a subcontractor of California Covered?
Who's that?
CGI.
There you go. Well, it's a vicious circle and cycle. So 10 seconds left, Patty. Where is this all going? Are we going to see this thing repealed this year at all? Are we going to see the Republican leadership step forward with some sort of plan? Are the American people going to rise up with pitchforks? Where is all this headed?
I hope so. I don't know that the Republicans have the spine to do it. I know that there's a big movement right now through FreedomWorks to try to involve the citizenry in actually building a marketplace-based healthcare system and try to put pressure on the Republicans to do that, not do what they've been saying they want to do, which is let's repeal and replace. And you know that replace is kind of tricky because they're going to want to fix what's there. It's still going to be a big, huge government top-to-bottom system, and that's just not right.
They've got to come out with a free market solution. Wipe out Obamacare, free market solution, that's it, period. We got to move on. Thanks, Patty.
Thank you.
Coming up next, Republican leadership at war with Tea Party conservatives as the Daily Ledger continues.